everyone, welcome back. I am G. Tarni, Assistant Professor, Faculty of Physiotherapy. So, I have 8 years of experience in teaching in Dr.M.G.R.Physio Education Research Institute. Today, we are going to talk about Euleria Riablo. This is a very unique rehabilitative device, an innovative medical device that has been recently invented by Euleria Riablo for the benefit of physiotherapists. So, what basically this machine does is, it consists of IMU sensors. This is a wearable IMU sensors and it comes with this IMU sensors and a stabiliometric platform. These are the platforms that is connected via Bluetooth to the system. So, through this what we can do exactly is, we can assess the patient and treat the patient. So, how it helps in assessing the patient is, these IMU sensors are connected to the patient, and the joint or the muscle which we want to assess is fitted, the IMU is fitted in to those joint or the muscles, and after that what we do is, we use the software to assess the joint range of motion. We can assess the joint range of motion, balance, mobility. So, this gives you an accurate and precise information regarding the assessment, and it helps the physiotherapist to frame the rehabilitation protocol in a better way. Apart from this, this software also has a rehabilitative gaming softwares. This actually is very useful in rehabilitating the patients because since it is a gaming type of rehabilitation, the involvement of the patient in the rehabilitation is very high, and the patient gets involved in the process of rehabilitation. That makes the job of the physiotherapist much better. So, we will go into the video and we will see how to fix this Riablo into the patient and how we can use it on the patient for the assessment purpose. The overall cost of this Euleria Riablo is around 19 lakhs. This was supplied from Rblo Private Limited. So, this system which has the software can be connected to a larger screen. Here what we have to do initially is, we have to click F2 and then we will get the user credentials. In this we have to go and add on the patient details. So, this is how we add the patient details. So, after we enter the personal data of the patient, we can go to the next thing. So, when we go next, we can assign the patient into a group, or else we can skip this and go to the next thing. So, after we create the data, personal data, a unique code for the for each patient will be generated. So, for this patient, the code that is generated is 7C5. So, it is created. So, now what we have to do is, we have to choose which body part we are going to assess, or we are going to focus on the rehabilitation. So, for the demo purpose, we are going to assess the hip joint. So, we have to choose hip, and then we can choose any parameter that we want to focus on: mobility, balance, weight transfer, strength, or functional. So, I am going to focus on functional. So, we have selected the hip range of motion and then give complete. So, once this is done, click on F2, click F1, okay. So, once this is done, what we have to do is, we have to give the initial assessment, click on yes, then just go through the instruction that is given there and follow the instruction. Okay. So, here you can see on the screen there are numbers that are being displayed. So, what we have to do exactly is, we have to fix the IMU sensors numbered, like right thigh they have numbered 2. So, we have to fix the right thigh with 2 and right tibia with 3, left thigh with 4 and left tibia with 5. And for fixing this over the body, we have this body straps. So, you can see these body straps comes along with the colors. So the color codes are also given in the screen. So we have to just follow the color codes and the numbers and then follow the instruction. Okay. So as I have already told you, this comes with the body straps and the IMU sensors and the pouches for the IMU sensors. So you have to just follow the instruction. So in the instruction you will see we have to tie this orange band to the tie. So fix this in the thigh. So fix this at the mid thigh level and the yellow one over the tibia at the mid tibia. So after fixing the band, the very important thing is we have to fix the IMUs at the right place. So for the right thigh, it is given as number 2. So select the number 2. See, this is 2. So I am just fixing the 2 IMU on the right thigh. So just fix it like this. So at the right tibia, fix number 3. So I will just remove 3 and fixing it with the sensor pockets over the right. Next one is left thigh, number 4. So it is very important to follow the numbers as given in the displays. So the next one is 5. So after you fix everything, what we should do is give next, enter. So it will take some time to calibrate. So the machine is getting calibrated. Okay, now just follow the instruction. So ask the patient to go for hip flexion. So first one is right, go for hip flexion along with the knee flexion at 90 degree. Yes, so passive. So on the screen you can see the range of motion. So this is an easy way for assessing the range of motion. So this is the right hip flexion and then come to rest again. Yes. Now left is at rest. Now repeat the same thing in the left thigh. Left hip, go for your maximum flexion. Yes, good. Come back to rest. So once this is done, give safe. So the thing what we have to do here is we just need to follow the instructions that come on the display. After that, give forward. So once this is done, now go in for your external rotation and internal rotation of the thigh. So lift the thigh to 90 degree, hip to 90 degree, go for external rotation, make the patient to do external rotation and then do internal rotation, maximum of your internal rotation. Do your external rotation once more. So this is an easy way to assess the range of motion without using the goniometry. So that makes the work of the physiotherapist easier. Now repeat the same thing repeat the same thing. Yes. So once this is done, give safe and move forward. So now go on for your hip abduction and adduction. The same thing, do on the right hip abduction. Go to the maximum range of motion. Yes. Do adduction, the maximum. Yes. So you can see the therapist without touching the patient can assess the range of motion. Do the same thing on your left. Okay, go to internal rotation, sorry, abduction. Yes, repeat the same. Okay, rest. Okay, again, save and then move forward. So this is the initial assessment that we have concluded after the initial assessment. So on the screen you can see this gives us an easy way. So you can see the active range of motion of hip flexion on right and left, external rotation and internal rotation, hip abduction and adduction. So it just takes few minutes to assess all the range of motion without touching the patient in a better way. So this is how the assessment using the Riablo is done. So now I will show you how to assess the balance using the force plate. So for that we have to go to sequence, give enter, and then we already have few preset programs here. So going for a preset program. So here again we need to follow the same thing. So ask the patient to stand on the force plate, then stand still at the anatomical position and then give next. Yes, the calibration is done. So now again we have to put the straps on the trunk, right thigh, right tibia and left thigh, and then we have to check the assessment. Put it over the trunk. So fix, as I have already told you, fix the same numbers at the denoted places. Okay, so after doing the assessment, now I will show you how to go on with the rehabilitation. So the rehabilitation will be like this. So the patient has to just follow the instruction that comes in the screen. So we will go with the EC medium initially. So EC medium, give enter. So now the patient needs to lift the right thigh in such a way that he goes through the thing. Yes, maintain the same. Try to catch that green one. Yes. Now try to enter the holes. So the patient will lift the hip in such a way that he will maintain his hip at 20 degree to do this. Yes. So now lean to that side and then left. One side lean paniko. So if the patient does any compensatory action while doing the action, it will be shown in the screen at the result. Lean panama straight up. So this gives you a feedback, a biofeedback of to the patient. The patient will get involved in the gaming, and at the same time his range of motion can also be improved using this software. So this is how the rehabilitation protocol is fixed. So for each patient, so the physiotherapist has to choose what has to be rehabilitated for the patient, So if it is a shoulder joint, we can use it for the shoulder joint. If it is for hip, we can use it for the hip joint. So the same thing is done. You can keep on changing it to the easy, medium, and the harder platforms as a progression for the patient. So we can use this for the progression and strengthening for the patient also. So now I'll show you how to assess the back in action. So this is very important test that can be used for sports personalities to check for their endurance, mobility, strength, everything, and to check whether they are fit to go back to their sports. So for that we have to click on back in action, and for that we need the stabiliometric platform. So that has been already connected to the system, and as usual please do enter the unique code for the patient, and then you have different tests in this back in action. So I am going in for the short test. So in the short test what we have to do is ask the patient to stand on the wobble board, the stabiliometric board. So now we'll see how to use this stabiliometric platform for assessing the back in action. So we have to just follow the commands as in this screen. Ask the patient to the subject to stand on the platform, stand on it, and now it's the trial. So ask the patient to go for a trial. The patient has to stand in such a way that he is bringing the balance to the center. Watch the screen, watch the screen. Try to bring your balance to the center point. Bend down, move forward, a bit forward, come little bit forward. Yes, try to come forward, a bit forward. Yes. So this is how we ask the patient to perform the back in action using the stabiliometric platform. Yes, so this is how it is done. So we can see the body sway, the bilateral stance, and how the patient is standing. So all these things can be assessed in this. Okay, so the next one in the functional test is the star exertion test. This is used for assessing the flexibility of the patient in back in action. So how it is done is fix the sensors at the body and then ask the patient to perform the test. So how this test is done is, come forward, ask the patient to complete this action as early as possible. So we can assess how long the patient is taking to complete this test. You have to jump forward, backward, jumps to the right, here, forward, yes, left, right, this side, yes, again, forward, back, this side, again this side, forward, to your right, yes, left, right, forward and backward. So during this test we can assess what is the duration taken by the patient to complete this action, and how he is standing on the right and left, and how much duration he is taking to complete this test, along with the mobility and balance. Thank you. So overall we can use this Riablo for assessing and rehabilitating the patient for orthopedic condition, neurological conditions, and also for your sports conditions. So this is a better aid for the physiotherapist to do their job, to make their job better and easier by using this. For precise and objective values, we can use this Riablo. Thank you all.